Study may shed a little more light on the risk of kids spreading COVID, something that's certainly top of mind for parents as restrictions lift. Joining us with more insight is Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Dr. Malley, thanks for joining us.
My pleasure.
All right, Dr. Malley, this study essentially showed that kids ages 8 to 10, so it focused on those ages, but I'm sure we could generalize it across the spectrum, but those kids put out a quarter of the aerosolized particles as adults when breathing, speaking, or singing. So what does this tell us about the chances for COVID transmission, especially in schools? I know a lot of schools starting Monday, kids go back, it's mask optional.
Yeah, I mean, those data are very intriguing, of course, because they could, in theory, explain why we observed what we observed, which is that schools have not, by and large, represented a very large focus of transmission of this virus, as opposed to, for example, what might happen with other viruses like the flu. So while I think these data are interesting, at the same time, they don't totally explain what's going on, because it's not what we see with other viruses where we know that children are very good at transmitting them to each other and also, as some of us have experienced, to their parents.
Well, as we've been reporting, there are other risks to kids from COVID, including a rare but dangerous condition called MIS-C. We saw a spike in pediatric COVID cases last month. Is it too soon to know if we'll see maybe a similar spike in related illnesses?
Yeah, it's a little bit soon, but I do think there's reason for optimism here based on data that the CDC has reported on two fronts. The first one is that vaccination with one of the mRNA vaccines results in an over 90% reduction in the risk of contracting MIS-C. So that's a really wonderful piece of information that we have. And then the other one that is also very encouraging is that it seems that for whatever reason, Omicron is less able, even in unvaccinated children, to cause MIS-C. So while every hospital in the country, including my own, is remaining very vigilant about the possibility of MIS-C cases surging over the next few weeks, I think there's a lot of reason for optimism thanks to vaccination and the fact that this very curious and dangerous virus in some circumstances in this new variation seems less able to cause MIS-C.
Well, that's certainly a bright spot. All right, Dr. Rick Malley with Boston Children's Hospital, thanks for your time this evening.
My pleasure.